A very good morning. The topic for today's discussion will be on scaling and root planing. Periodontal scaling is the therapeutic procedure which is performed by a dentist or a dental hygienist to remove all mineralized hardened deposits from the tooth surfaces. It is performed supra and subgingivally and can be done using a non-surgical, that is closed, or a surgical or a open approach. The parts of a periodontal instrument include the handle, the part of the periodontal instrument which is used for holding the instrument, as you can see in the picture. A represents the handle, the shank, which is a rod shaped length of metal located between the handle and the working end of the dental instrument, as you can see in the picture B. The working end, that is the part of the dental instrument which does the work of the equipment, that is C, which is represented in the picture. So moving on to classification of periodontal instruments: periodontal probes, explorers, scaling, root planing, curettage instruments, ultrasonic and sonic instruments, periodontal endoscope, and cleansing and polishing instruments. So uses of dental mirror: it is used in indirect vision, illumination, that is for reflection of light, trans illumination, that is reflection of light through the tooth surface, especially for calculus, and for refraction. So the probe is a primary instrument in the periodontal examination. It is used for assessing the gingival health, periodontal status of the patient, as well as exploratory, which requires skill development. The probe design varies in cross-sectional, which is rectangular in shape, that is flat, oval, or round, and it has a millimeter markings. It is calibrated at varying intervals. First, talking about the Marquez probe, it is a color coded. There are 3, 6, 9 and 12 millimeter markings. It has got a thin working end. The key is to know the increments and the type of probe that is being used. So the use of the probe is, it is inserted into the junctional epithelium. It is used to measure the gingival sulcus, periodontal pocket, gingival recession, as well as for attachment loss. So the probe angulation is very important. The probe should always be placed parallel to the long axis of the tooth, as you can see in the first picture, which is a correct position. The interproximal angulation, that is it should be slightly tilted and it is apical to the contact point. In the first picture you can see that there is no enough angulation. The second one is a correct angulation and the third one is too much of angulation. The adaptation of the equipment is also very important. The working end should be well adapted to the tooth surface, and the technique is gently walk around the tooth surfaces. So all the 6 surfaces has to be examined: the distal, which includes distobuccal, distolingual, the buccal and the lingual, and the mesial, which includes mesiobuccal and mesiolingual. As you can see in the picture, the deepest reading within the designated areas is important. So the periodontal probes are inserted with firm gentle pressure to the bottom of the pocket. Explorers, the purpose is to locate the subgingival deposits of calculus. It is used to detect caries, check the smoothness after root planing. The sickle scalars are primarily used for supragingival calculus removal. Is also very useful instrument. It is often the first instrument which is used to remove heavy, large deposits, thus improving access to subgingival area for other instruments. The uses include supragingival calculus for removal of the stain. Even slightest subgingival 1 to 2 millimeter can be removed. A number of different sickle scalars are available in variety of shapes and sizes, which includes jacket scalar, Morse scalar, 204S and 204SD. They all, however, have common features making them suited for the removal of heavy calculus deposits and working interproximally around the contact areas of the teeth. A flat blade cut at 90-degree angle to the shank, cutting edges on both the sides of the face of the blade. The face of the blade is triangular, tapering to a strong sharp point at the toe. The face of the blade may be straight or curved. It is the sharp pointed toe and the first 1 to 2 millimeter of the lateral cutting edges that perform the work. The design characteristics: it is straight rigid shank, 2 cutting edges straight or slightly curved. Back of the instrument may be pointed or rounded. The curettes includes the instrument of choice for removing the subgingival calculus, root planing, altered cementum, and removing the soft tissue lining. The first picture depicts the universal curette and the second the Gracie curette. So the types of universal curettes includes Columbia, Barnhart, Blunting, Goldman, and Langer. Design features: it can adapt to all tooth surfaces, 90-degree blade angulation, shank curvature allows adaptation, both cutting edges are used, and blade curved only one angle, as you can see in the picture. The universal curette has an offset blade angle of 90-degree and the Gracie curette has 70-degree. The Gracie curettes are area-specific instruments with each blade adapting to a specific tooth area or surface. The blade of the Gracie curette is offset at an angle to the lower shank. The shape of the blade is semicircular. The face of the blade offset is 70-degree to the lower shank. It has 2 cutting edges. Only one cutting edge of the Gracie curette blade is used. The rounded convex back of the curette, which allows its placement into the periodontal pocket with minimal laceration or discomfort. Only the lower third or half of the blade contacts the root surface during instrumentation. The Gracie numbers 1, 2, 3, 4 are used for anterior tooth, 5 and 6 is used for anterior and premolar, 7 and 8 is used for posterior teeth, buccal and lingual surfaces, 9 and 10 is used on the lingual surface, 11 and 12 posterior mesial surface, 13, 14 posterior distal surfaces, 11 and 12 are the modifications of 15 and 16, 13 and 14 are the modifications of for 17 and 18. The area specific curettes helps us to adapt to the specific area of the tooth surface. It has got two curved edges with the blade. Only one cutting edge is used for calculus removal. It makes one cutting edge lower than the other. This lower end is that is used for instrumentation. So how to identify the cutting edge? Place the shank perpendicular to the floor. Lower blade is the cutting edge. The lower shank will be parallel to the surface that is being scaled. What are the advantages? It allows insertion into the deep pockets, prevents tissue trauma, correct the cutting edge to the tooth surface angulation, easier adaptation around convex tooth crowns to access tooth surfaces. So as you can see in the picture, the 15 Gracie curettes which is used 11, 12 on the mesial surface of the molar, we can see that the shank is perpendicular to the long axis of the tooth, parallel to the long axis of the tooth. The characteristics of the files functions to crush the tenacious calculus. It is used to supragingivally and subgingivally. It is used in full stroke. It has a series of plates and is not suitable for fine scaling and root planing. Moving on to chisel scalars, the functions are to remove the calculus. It is used mainly in the proximal of anterior teeth that are too closely spaced. It is used in the push stroke only. The cutting edge is 45-degree bevel. The functions of hose scalar includes to remove ledges or rings of calculus. It is used supragingivally or subgingivally. Important to maintain a two-point contact with the tooth to stabilize the instrument. It is used in full stroke. The cutting edge is 45-degree bevel. Moving on to principles of instrumentation. Accessibility, that is the positioning of the patient and operator, as you can see in the picture. 12 o'clock, 11 o'clock, 10, 9 and 8 o'clock position. Same way 1 o'clock, 2 o'clock, 3 o'clock and 4 o'clock position. The next general principle of instrumentation is a visibility, illumination and retraction, condition of instruments, maintaining a clean field and instrument stabilization. So moving on to the grasp, palm and thumb grasp, modified pen grasp and pen grasp, finger rest, intraoral conventional finger rest, as you can see the rest which is taken from the adjacent teeth. The intraoral opposite arch finger rest, where the finger rest is taken from the opposite arch, and then the intraoral cross arch where it is taken from by crossing the arch, and the intraoral finger on finger as you can see in the pictures. Moving on to the extraoral palm down fulcrum, the extraoral palm up fulcrum. These are the extraoral finger rest. Moving on to instrument adaptation and angulations, 45 to 90 degree, greater than 45 and less than 45 degree. The strokes are also very important. Oblique, exploratory. This is the action of the working end on an instrument as it is moved across a tooth surface. Exploratory strokes provide light tactile feedback from the instrument tip. Working strokes provide controlled pressure against a tooth surface using an appropriate cutting angulation. The scaling strokes are short pulling strokes which is made with firm pressure to remove increment from root and enamel surfaces. The root planing strokes are made to remove deposits and smooth the root surface. Working strokes are ideally a series of overlapping strokes covering the entire tooth surface. So exploratory versus working stroke, the blade is less than 45 degree, the grasp is lighter, tactile sensitivity is enhanced on the downstroke, and objective is to identify the depth of calculus. Thank you.